Hello, I'm Dr. Ellie Harrison. Niten ein Paranisten.
Have you ever drunk water during the day? I barely drink, but when I do, even half a cup turns into 2 cups. Then I'm up 1 time, 3 times, sometimes even 4 times. Should I get up? Just for a moment. I fall asleep, and my lower abdomen feels slightly tight. That sensation wakes me up, and when morning comes, my head feels heavy and my body feels tired. But why? Have you ever felt unsure like this? Have you ever asked yourself, maybe I slept all night, so why doesn't my body feel rested at all? If you think it's just age, or just because you drank a little too much water, you may be feeling the warning your body is sending you. You might be missing important signals. Your circulatory system may be out of balance. As that balance starts to break down, it affects your bladder and kidneys, and even the small blood vessels that normally keep inflammation quiet. Because when you begin to feel weak, your body reacts like a river that is gradually drying up. The flow becomes heavy, and circulation starts to get blocked. Things that should have been smooth become confused. And if that imbalance lasts for a long time, your sleep quality is affected. Your body feels like it's collapsing, and your bladder becomes so sensitive that even if you pass only a little urine in the middle of the night, it wakes you up. But the good news is this: small, correct changes can fix the situation. It can be reversed. The real reason you keep waking up is not simply because your kidneys are weak. If possible, try making one very simple habit before going to bed. Just one thing can help your body become stable again. I can help you with that, and I'm going to tell you this story. If you stay until the end, you'll understand what's really happening inside your body, and you'll learn how you can get deep sleep back every single night. Before we begin properly, if you find this health topic helpful, please follow, comment, and subscribe to the channel. Sometimes, sharing the right health information can become the exact seed someone else needs. And if you want videos with more depth, leave just one comment. I read them all. Today, I'll quickly summarize what you're about to hear. Why do so many Koreans wake up several times at night, even though kidney, bladder, and hormone tests all come back normal? I'll explain the real reason. You'll learn why a water, salt, mineral imbalance, and microvascular chronic inflammation can be the silent culprit, and what can improve it. And especially, you'll discover how one very small change can sometimes have an amazing effect. If you're listening, you may have already noticed this yourself. You have a problem that hasn't been solved, don't you? My name is Yuho Jin. I am a specialist with over 30 years of experience, working at a university hospital. Over the years, I have met countless Korean patients. And almost everyone says the same thing before leaving the exam room. Doctor, every night I wake up 3 times. Sometimes 4 times. Is there something wrong with my kidneys? Or am I aging faster than other people? What's surprising is that most test results are completely normal. The kidneys are healthy, and there's no bladder problem. In men, the prostate is normal, and urine tests are clean. But when I take a deeper look at inflammation-related markers, I often see inflammation levels that are higher than ideal. It isn't acute inflammation. It doesn't hurt, it doesn't sting, and it doesn't look red, but it exists quietly in the small blood vessels, reducing their function. It's hidden inflammation. And those blood vessels play an important role in keeping the body stable during the night. I remember a 50-year-old male patient named Jong Si-hun very clearly. He told me that every night he woke up at least 3 times, and every morning his body felt heavy and uncomfortable. But his test results were all good. Only one thing stood out: mild chronic inflammation, and a slight decline in lower body circulation. When I asked about his habits in detail, I learned he was restricting water at night to avoid thirst, and sometimes he held back even more because he was afraid he'd need the bathroom. Also, because of his family's advice, he ate dinner extremely bland. He didn't realize that this kind of self-restraint pushes the body into homeostatic stress. It thickens the blood, reduces circulation, and makes the bladder more sensitive. That was the turning point. Then there was a 70-year-old patient, Kim Mi-jong. She was almost certain her kidneys were weakening because she woke up at night so often. but her ultrasound showed completely normal kidney function. The only abnormal clue was that her calves swelled slightly in the afternoon, and she was drinking far less water than she needed. She told me, "The more I drink, the more I go, so I don't drink at all." But when the body lacks water and salt, it reacts by increasing the signal to balance osmotic pressure. So the more you restrict, the more often you feel you must go to the bathroom. This surprises many people. I also remember a 60-year-old patient named Jangwoo Hayuk. He woke up at the same time every day, around 2 or 3 in the morning. It didn't hurt or sting, but even the smallest pressure woke him immediately. When I reviewed his results, I found slightly elevated inflammation and a long, standing habit of excessive dietary restriction. He always fell asleep feeling a little thirsty. He believed he should never drink water before bed, so he endured it. That very imbalance made his autonomic nervous system overly sensitive at night. There are countless cases like this, and as I see them repeatedly, I notice one common point. Nighttime awakenings are not always kidney disease. They're often the result of small, long-lasting disturbances building up over time: mild vascular inflammation, poor circulation, a water imbalance, and an overactive nervous system. The body doesn't wake you up for no reason. It sacrifices sleep to correct an internal imbalance. That's why I want to tell you this story. Because when you understand what is really happening, you can help your body regain the stability it has lost. I've seen too many similar cases. As I observed more and more, I realized something important. People aren't waking up because they produce too much urine. They're waking up because the bladder and the nerves controlling it become abnormally sensitive. During the day, even if the urine amount is the same, it may not bother you at all. Some people can sit through a 2-hour meeting without feeling any need to urinate. But once the sun sets, everything changes. At night, the body enters a resting state. The heart rate slows, and circulation becomes sluggish. And in that moment, the imbalances that stayed quiet during the day suddenly become obvious. The autonomic nerves that control the bladder become more sensitive when the internal environment is unstable. Even a tiny change in osmotic balance can make the bladder send a wake-up signal. Many patients ask me, "Doctor, if I didn't drink water, where is all this urine coming from? Why do I still have to get up?" The more I endure, the worse it feels. The answer lies in the body's fluid control mechanism. Especially when you drink too little water at night, your blood becomes more concentrated. The body views that as dangerous. As blood concentration rises, the heart, kidneys, and circulatory system have to work much harder. To protect you, the kidneys start draining water to reduce that concentration. In other words, the body increases fluid excretion to dilute the blood. And the result is that at the very time you should be sleeping, you end up going to the bathroom more often. The more dehydrated you are, the more blood flow to the bladder's capillaries becomes compromised. These capillaries are tiny, and they react strongly to even the smallest environmental changes. That makes nerve cells fire more intensely. So many patients tell me, "I just fell asleep, and then even a very light sensation in my lower abdomen made me suddenly wake up," even when there's hardly any urine. This isn't a bladder disease. It's a system-wide imbalance. And for Koreans, there's another very common habit that creates a separate problem: eating too blandly. If low sodium continues for a long time, water cannot stay properly inside the blood vessels. It slips easily into the tissues. That's why swelling can appear in the afternoon. But paradoxically, at night, water inside the blood vessels decreases. When you lie down, the water that pooled in tissues during the day returns to circulation. Then the kidneys must process that fluid, and the result is more trips to the bathroom. When I explained this to Kim Mi Jong, she stared at me in surprise and said, "So the more I restrict water and the less salty I eat, the more my body processes it in a different way, and it becomes harder." Yes. The human body doesn't follow simple rules like drink less, urinate less. In reality, the opposite is often true. There is one crucial fact most patients don't know: low-grade, chronic inflammation, without pain, stinging, or fever, can directly affect the structures that control the bladder. In studies, when microvessels are mildly inflamed, the flexibility of kidney cells decreases. The nerves controlling the urinary reflex release less oxygen, and their ability to transmit signals is reduced. In truth, when nerves are influenced like this, they activate more easily and become overly sensitive. Even the smallest stimulus triggers a signal. I looked again at Zhang Wu, Hyok's records one morning. His CRP inflammation marker was not at a dangerous level, but it was outside the optimal range. This pattern has repeated itself in many patients. They feel no inflammation at all. There is no pain and no stinging. Everything seems fine. But at night, those small inflammatory signals make the whole system more sensitive. What's even more unfortunate is that long-term lifestyle habits, restricting water, eating too blandly, irregular sleep, and prolonged stress, prevent this quiet inflammation from disappearing. One day, a 55-year-old man named Yoon Jaebyum came to see me. He said he woke up exactly at 2 a.m. every night. It felt like a strange alarm was going off inside his body. This had continued for a full year. During the day, he had no problems at all, but once he lay down, discomfort appeared quickly. I learned he was under constant stress at work, and on his own he had been following a very clean diet, believing it was good for cardiovascular health. But his minerals were already depleted, and his nervous system was chronically overexcited. Nighttime was when that imbalance became most obvious. What struck me most was how many people misunderstand this issue completely and try to solve it in the wrong direction. Some people drastically reduce evening water. Others stop drinking altogether. Some avoid even fruits and soups. Others believe the solution is to completely empty the bladder, so they go to the bathroom multiple times before bed. But these methods only scratch the surface. The root problem, silent changes, poor circulation, elevated inflammation, and water-salt imbalance, remains unsolved, and the situation worsens. I always tell my patients, the body is like a water tank, but it's not as simple as put in less, get less. The body is a sophisticated control system. Water, salt, minerals, nerves, and microvessels are all interconnected. If one link slips out of alignment, the whole system becomes unstable. And nighttime waking is simply one visible result of that instability. That is why one small habit can change the quality of your sleep. Understanding this is the foundation. The goal is not simply to reduce urine volume, but to help the body regain the stability it has lost over many years. Add a small pinch of salt and a slice of lemon to a cup of warm water. Drinking that can reduce nighttime awakenings. When I first began explaining this, many people widened their eyes, as if I were saying something completely opposite to common sense. In Korea, drinking water before bed is almost seen as taboo. Many people firmly believe that the more they drink, the more often they will need the bathroom. But if you do it the right way, in the right amount, and with the right composition, the body responds very differently. I always tell them, it's not the water that wakes you up. It's the instability inside your body that prevents you from sleeping. That's the real reason. And to explain that, the easiest part to understand is warm water itself. When warm water enters the body, it gently relaxes the capillaries. It opens pathways for blood flow, like widening narrow passages. As circulation improves, the bladder, pelvic floor, and lower limbs receive more blood flow. Tension in the nerve fibers around the bladder eases, and sensitivity decreases. Many patients tell me that just drinking warm water in the evening makes their bodies relax. Their hands and feet get warmer, and even their nightly waking decreases after a few days. But warm water is only part of the story. The part that surprises people most is a tiny amount of salt, just a pinch, barely noticeable. This salt is not for seasoning. It helps maintain stability in the blood vessels overnight. Many patients believe cutting salt is always the key to health. I've seen that belief many times. But if you reduce it too much, water cannot stay in the blood vessels. The body becomes unstable and keeps trying to increase and control the urinary signal. A pinch of salt helps the water you drink stay in the blood vessels rather than leaking into tissues. It stabilizes the diluted state of the blood, reduces the burden on the autonomic nervous system, and prevents internal fluctuations from over-stimulating the urinary reflex. As a result, the wake, up signal becomes quieter. And the last part is lemon, just one slice. Many people think it's only for smell, but lemon plays a very important role. It contains vitamin C and antioxidants, and it helps calm the inflammatory response in microvessels. When I explain this, many patients fall silent for a moment. They never imagined that a tiny slice of lemon could affect sleep at all. But lemon also contains potassium, which helps balance sodium. As a result, internal pressure stays more stable, and this is very effective at night in preventing excessive bladder stimulation. One day, a 70-year-old patient, Han Jong-hoon, came in with a noticeably brighter face. He told me that in the past, every morning his head felt heavy. His vision was blurry, and his body tingled as if he hadn't slept. But after mixing warm water with salt and lemon and drinking it before bed for about a week, the first change was not the number of nighttime trips. It was how he felt in the morning. He said, "When I wake up, my head feels light." His body felt more refreshed. At first, he thought it was coincidence. But he kept doing it, and the change became real. After 3 weeks, his nighttime bathroom trips dropped from 4 times to once or twice, and some days, only once. Another case was a 60-year-old woman, Parklia. She had leg cramps every night and also had to use the bathroom frequently. But after only a few days, she said her hands and feet became warm, the cramping nearly disappeared, and sleeping became much easier. This wasn't because she drank more or less water. It was because the water she drank finally stayed where her body needed it. It didn't upset the balance by pooling in tissues or shifting improperly. What I realized most clearly is this: the core is not drinking. The core is restoring the body's already collapsing balance. For years, too many people have focused only on reducing water at night. They were afraid to drink water, and their bodies stayed on constant alert. The autonomic nervous system remained tense. In that state, even very small stimulation makes it easy to wake up. When I explain this to patients, I always say the same thing. This method is not a cure and not a miracle. It simply restores the conditions the body needs to function normally. Sufficient moisture inside the blood vessels, the right mineral balance to nourish the nerves, and enough circulation to restore stability. Only when these 3 return does the bladder send fewer false signals. Then sleep naturally becomes deeper. What impresses me is how many patients say the same thing after seeing changes within a few weeks. "Doctor, why didn't I do this earlier?" And I always answer the same way. Problems that have lasted for many years can sometimes begin to resolve with one correct adjustment. The most important thing is understanding that the body is always trying to help you. It's always signaling that something needs correction. Nighttime waking is not your fault, and it isn't simply a sign that your kidneys or bladder are weak. It's a small reminder that internal balance is shifting. If you create the conditions for stability again, your body can restore the deep sleep you've been missing for a long time. Once you understand why warm water, a pinch of salt, and a slice of lemon can make such a difference, the next question becomes important. So how do you make your body respond in the best way? This is the part I explain very carefully. The effect depends not only on the ingredients, but also on timing, method, and consistency. So I will explain from the beginning. Many people think the closer to sleep, the better. But that isn't true. Before sleep, the body needs time to absorb, distribute, and stabilize the water-salt mineral balance. Ideally, drink it about 1 hour before going to bed. In that time, circulation warms up, the autonomic nervous system stabilizes, and the bladder is not overstimulated by sudden, late fluid shifts. If you drink it immediately before lying down, your body has no time to adjust, and it can have the opposite effect. Now, the temperature matters. I always emphasize this: the water should be warm, not cold, and not too hot. Cold water constricts blood vessels and reduces circulation, which is the opposite of what we want. Water that is too hot can stimulate the stomach lining and make the body feel more alert. The warmth you want is like soaking your hands in warm water in winter, the kind of warmth that feels comforting. That feeling is a signal that the body is relaxing. Next is the amount of salt. Many patients hear salt and immediately worry about blood pressure or heart strain. But I always make it clear this is not for flavor. It's a tiny pinch, almost unnoticeable. Not even a teaspoon, not even half a spoon. Just the minimum amount needed to help water stay inside the blood vessels rather than washing out. This amount does not raise blood pressure in a meaningful way for most people. Many patients feel relieved when they finally understand that. What you need is not more salt. It's simply a small support to help the body function properly during the night. Finally, the lemon. One thin slice is enough. When placed in warm water, the gentle lemon scent itself can relieve tension. And when the body absorbs lemon's citrate and vitamins, it can help calm silent inflammation in the microvessels. For people with nighttime waking caused by microcirculation problems, this small support can bring remarkable change. Many patients say that after only a few days, their bodies feel lighter. Their hands and feet become warmer. And before sleep, they feel less pressure on the bladder. As important as the ingredients is the way you drink it. I always say don't swallow it in seconds. Drink slowly, little by little. You need to give your body time to adjust. Then the water flows naturally through circulation and is distributed properly. If you drink too quickly, the body can overreact and the effect may decrease. Slowly and consistently. That is the key. Of course, this method is not for everyone. If you have moderate to severe kidney failure, or if you are on strict fluid restriction, you must consult a doctor. But for mild imbalances caused by lifestyle habits, or for healthy adults, this method is generally very safe. I often think of a 75-year-old patient, Lee Chang-Yale. He was extremely disciplined and followed instructions faithfully. When I explained this method, he followed every step exactly. A week later, he returned with a surprised and happy expression. He said, "Doctor, I did something I haven't been able to do for years. I slept over 4 hours without waking even once. Even that one stretch of deep sleep made him look younger." His mind cleared. His steps felt lighter. The swelling in his legs decreased. His head was no longer heavy in the morning. And above all, his anxiety about his health disappeared. Another patient, a 60-year-old woman named Han-ji Min, had worked nights for many years and suffered from insomnia. When I explained the method, she doubted it. But after practicing consistently for more than 2 weeks, she felt change for the first time. The change wasn't only the number of bathroom trips. It was the way she fell asleep. Warmth spread from her legs into her whole body. She said, "Doctor, it feels like there's a small stove inside me. That is a sign the cycle is improving." As circulation improves, the autonomic nervous system relaxes, and sleep becomes deeper, naturally like breathing. I often tell patients that small changes require time. Some people feel results in a few days. For others, it may take a week or 2. The important thing is understanding that the body is slowly regaining the balance it lost over years. Recovery does not happen overnight, but as balance returns, the body begins to enter the deep sleep it has been longing for. And every time I see patients' eyes brighten, I'm reminded again that the human body has a far stronger healing power than we imagine. If we simply provide the right conditions, the body can heal itself. It regulates itself. It stabilizes itself. And it recovers itself. Thank you for listening to my story. I know it isn't easy to follow a long health story all the way to the end, but I truly believe that everyone needs deep sleep, a healthy body, and the right to feel light and refreshed. If what I shared makes your life even a little better, that is my greatest joy. If you found this helpful, please leave a comment and subscribe to the channel. Your story, shared someday with someone else, could become hope for another person living through the same fatigue you've experienced. May warm nights and long, deep, peaceful sleep be with you.